Thank you very much. That brings us to the end of the first phase of the briefing. We shall now take the questions. Ministers will take their notes and then respond after the basket is filled. We have 10 questions. You have taken your numbers. Please observe our rules. Just go straight to your question. Thank you.
Good afternoon, all. My name is Nike Adebowale. I report for Premium Times. Okay, my first question is for the Minister of Health. Sir, can you please update Nigerians on the index case of COVID-19 in Benue State? There are speculations that the patient has been in National Hospital for several days without being treated. Also, someone sent in this question. More persons living with disabilities are reported to have tested positive to COVID-19 in the United States. What is being done to ensure same doesn't happen in Nigeria? Then someone said, please ask the SGF why it doesn't want to tell us the nation's plan, why it doesn't want to tell us the task force plan for people living with disabilities. Thank you.
Good afternoon, sirs. My name is Juliana Taiwo Balonya. I write for the Sun newspapers. SGF, sir. Is the government making use of the National Primary Healthcare Development Agency at all in this fight? I ask because I know they are not part of this committee, but I've been following their Twitter handle, and there is no information on how the primary healthcare centers at the grassroots level are getting ready in case the virus hits the community. Secondly, it worries me because I see how other nations like Ecuador are dealing with the crisis. How are you reaching the communities on COVID-19 sensitization? Yes. The SGF, yes. I am aware of the National Emergency Operations Center, which does a great job in polio eradication. Don't you think that the body can be used to effectively handle the crisis if it gets to the community? Somebody wants to know why Women Affairs was left out of the ministry to come up with a policy for the realities of a post-COVID-19 future in the president's speech. We want to believe that this was an oversight, or was it deliberate? If not, are they going to be included? The last one is northern governors have said they cannot afford to lock down their region. SGF, sir, clearly your engagement with the NGF seems not to be yielding results with positions like this. Don't you think there's a need to deploy another strategy if indeed we are to flatten the curve? Thank you.
The Chairman, National Coordinator, as well as the IGP of Police. My name is Amaka Ode. I report for Arise News. And my first question actually goes to the Minister of Health. Well, we want to get an update on the distribution of the JACMA donations that came into the country some time ago, how this has been distributed amongst the states, especially maybe those who have recorded significant numbers of confirmed cases, really. And the next question to the Minister of Humanitarian Affairs. Well, we are getting reports out of Lagos and Ogun State as the hours go by, and there has been complaints about, the palliatives, the distribution, especially when it comes to cash to the poorest of the poor. So we'd like to get an update as to how that is being done in states under lockdown, aside from the FCT. All right. And the next question is to the Inspector General of Police. Well, sir, there's a lot of complaints about the way your men are handling this lockdown. There's even been allegations. I personally carried out an investigation, and I found that some of your men collect bribes to let people who are not essential workers to pass through. So I want to get an update as to what you're going to do to check that, and also for some essential workers, especially food sellers, they have complained. Some of them don't have any form of identification, and these are essential workers that the president have allowed to go and sell to the people. But yet, they're having challenges getting to the stores to sell to people who are hungry. So I want to get an update from you concerning that. Thank you.
Good afternoon, members of the Presidential Task Force on COVID-19. My name is Yemi Adebayo from AIT. It's quite shocking that the Inspector General of Police is here today. Firstly, sir, I want to ask you, there are reports from Lagos and Ogun State, residents there who perhaps in the wake of the attacks by the armed robbers would reach out to the various divisional police commands, are being told to take the issue of security seriously themselves, and most residents there now have not turned out to, observing night duties themselves in terms of forming some sort of vigilante by themselves. I want to know, beyond these teams that you've deployed to Lagos and Ogun State to ensure that these criminals are not allowed to operate, what other measures are you putting in place in terms of response when people actually call the police officers on duty to actually come to their rescue in cases like this? Then I would want to ask the Honorable Minister of Humanitarian Affairs. So much has been said about palliatives. I want to find out, are you in the know, probably maybe senators and lawmakers will advance billions of nairas to distribute in their various constituencies as palliatives to people in those areas? Are you aware of this? Then for the PTF coordinators, I want to find out, what is the average turnout rate of COVID-19 test results in Nigeria? What is the average turnout rate of COVID-19 test results in Nigeria? I also want to find out from you, sir, how can the turnout rate be improved upon so that infected persons do not spread infection in the community while awaiting their results? Then finally, the IGP, I know you also want to respond to this. Livestock and other produce are being delayed by security personnel at some point. What are you doing in this regard? Livestock and other food produce are being delayed by security personnel when moving them to some locations. What are you doing in this regard? Thank you very much.
Good afternoon, sirs. My name is Friday Okerigbe. I'm a reporter with Channels TV. I'd like to ask my first question directed to the Ministry of Health. It has to do with the fear of community transmission of the virus that you have stated. You stated it yesterday, and you also restated it today. My question is, in the face of the weak primary healthcare system that we have, what strategy are you putting in place to ensure that, should we have explosion tomorrow because of the fear of community transmission that you're already talking about, how are we going to manage it? Because we know that the primary healthcare system we have today cannot handle it. It's very weak. What strategies do you have in place? The second question, I would like the NCDC boss to respond to it. You noted that the challenge we now have is not about the number of laboratories. We have enough laboratories. And you also have the human resources to actually man most of these laboratories. But you said that there is a weak link in the chain. Of course, if I'm to use the exact word that you used here, you said the challenge has to do with how to make the response more effective. That's the word you use. I would like to know, what do you think is the solution to that challenge? Haven't identified the challenge. And thankfully that the IGP is here. I would like to know if you have instructed any of your commissioners to issue pass to people other than the category of persons that the president actually listed when he first gave the first 14 days lockdown. Because like one of my colleagues said, in FCT here, there are a lot of commercial drivers who have pass, are claimed to have been gotten from policemen, and they are using it on the road. We also have a lot of policemen who do not respect the press ID card. This morning, I was harassed by a police officer, but I stood my ground. I told him to show me a portion of the president's speech that says journalists should show a pass other than their their press ID card. And when he saw the way I was standing on my ground, he let me go. But there are lots of journalists who are actually facing that. Have you instructed any of your men to do that? And also, I would like to ask this because the Minister of Education is here. There was an outcry from a friend who is a lecturer who said that the lockdown, the extension of the lockdown is not going to be easy for them because the federal government have not paid them since February. Is that true?
Good afternoon, the chairman, members of the Presidential Task Force, and my colleagues. My name is Mitaire Ikwen from the NTA. In parts of the Federal Capital Territory, you see pedestrians stranded at some junctions, and you wonder how they got there in the first instance because you see them clustered and waiting for vehicles. I don't know if the restriction order is only for vehicles and not for pedestrians. So I want the Inspector General of Police to provide answer for that. Again, we're beginning to experience rising cases of COVID-19 in neighboring countries like Cameroon and Chad. And this could definitely endanger states bordering these countries. I want to ask if the NCDC is doing anything to protect land border states in the country. And again, I want to ask the Minister of Humanitarian Affairs, what support or palliative is the ministry planning for private workers who rely on daily income, and as a result of this lockdown, they have been temporarily stripped of their livelihood? Is there any plan for them? And again, for the Minister of Education, we now have our children at home at this time, and they are out of school. Is there any plan to have perhaps maybe an educational program that can be relayed on television or via online via the internet? If there's any plan, please let us know. Thank you very much.
Good evening, the SGF, honorable ministers, and my colleagues. My name is Rahila Lassa. I report for Voice of Nigeria. My first question is a feedback from an apprehensive audience. He said I should ask the NCDC DG if the cases of COVID-19 recorded recently are mainly from people who came into the country and exhibited some symptoms of the COVID-19, or are there cases from people who have been on self-quarantine, then later show the signs of COVID-19 during the 14 days period? Secondly, there is a video going around both the social and the traditional media of a woman from Benue State alleging that she is COVID-19 negative, but that the Benue State government lied against her that she is positive. I want to know the true state of the matter. Thank you.
Ẹ kú dédé àsìkò yìí o, gbogbo ẹ̀yin mínísítà wa. Orúkọ tèmi ni Abiodun Olóyèdépúpọ̀ láti ilé akéde Nigeria, Voice of Nigeria ní ẹ̀ka èdè Yorùbá. Màá fẹ́ kí mínísítà fún ètò abẹ́lé kí wọ́n jọ̀ọ́ kàn bá wa dáhùn àwọn ìbéèrè yìí ní èdè Yorùbá. Àkọ́kọ́, nígbà tí bàbá wa ìyẹn ààrẹ yanyan lórílẹ̀‐èdè Nàìjíríà ní ààrẹ Muhammadu Buhari tí wọ́n bá wa sọ̀rọ̀ ní ọjọ́ 29 oṣù kẹta ọdún yìí nígbà tá a fẹ́ bẹ̀rẹ̀ ìséde yìí, wọ́n jẹ́ kó yé wa wípé àwọn yóò pèsè iṣẹ́ fún àwọn ọ̀dọ́ tí wọ́n tó 1000 ní gbogbo ìjọba ìbílẹ̀ kankan, ìyẹn 774 local government ní orílẹ̀-èdè Nàìjíríà. A fẹ́ mọ̀ bóyá eléyìí ti wá sí ìmúṣẹ. Bákan náà ni wọ́n ṣe ìlérí wípé àwọn fẹ́ jọ̀wọ́ ọkọ̀ fún àwọn àgbàdo ìrẹsì. Ǹjẹ́ a fẹ́ mọ̀ ọ̀dọ̀ àwọn tó ti dé àti àwọn tó ti rí ìgbà, ṣé lóòótọ́ ni wọ́n ti rí? Bákan náà mo fẹ́ kẹ́ bá mi dáhùn ìbéèrè yìí láti ọ̀dọ̀ àwọn elétò ààbò wa. A rí i pé àwọn ọlọ́pàá lótìtọ́ àti lódodo a ní pé wọ́n ń ṣiṣẹ́, ṣùgbọ́n a rí i pé ní ìpínlẹ̀ Ògùn àti ìpínlẹ̀ Èkó ojoojúmọ́ ni wọ́n ń pariwo látìgbà tí ìséde ti jáde wípé wọ́n ń ja àwọn ní olè. Bákan náà àwọn ọlọ́pàá ǹjẹ́ àtẹ̀ ní nǹkan kan tá a ní fún wọn torí pé púpọ̀ lára àwọn ọlọ́pàá tá a bá ń pàdé lọ́nà wọn ò ní ìbomú bẹ́ẹ̀ ni wọn ò ní ìbọwọ́ síbẹ̀ wọ́n sọ wípé wọ́n ṣiṣẹ́ láti gbógun ti àrùn COVID-19 afẹ́kẹ́ bá wa dáhùn àwọn ìbéèrè yìí ní English just for me to explain in English so that we all understand what I'm trying to say. The first thing is that Mr. President in his address on 29th of March 2020 promised that each of the 724 local governments will employ 1,000 youth. We want to know how far the governments have gone about this. Then there was also the promise of releasing grains and releasing of 150 trucks of rice. Where are the palliatives and how were they distributed among Nigerians? Also for the security, how far? How is the security personnel, how are they being treated? Most of them, when we see them on the road, they don't have masks, they don't have anything. We just want to know if truly we are really taking care of them. And also in Lagos and Ogun State, there are shots of hoodlums, armed robbers, every day since the day of this lockdown. We want to know how far the security is doing about it for the security of the lives and properties of Nigerians. Thank you very much, sir.
Chairman of the task force, honorable ministers, my colleagues, my name is Emmanuel Kutara, Radio Nigeria. Minister of Health, sir, yesterday you received some items from the United Nations, among which were 50 ventilators, I believe. I want to know how those items will be distributed. Also, sir, there are complaints from your ministry, some nurses that have been assigned as essential workers to Nnamdi Azikiwe Airport. They complain that the bus they're supposed to carry them to their place of work, they don't come. And there's no emergency or hazard allowance being given to them. And to the national coordinator, I want you to help me clarify the issue of bank operations, because you said banks are exempted, but still they don't open for operations. So please help me to clarify that aspect. Thank you.
Good afternoon, Mr. SGF, Honorable Minister, DG Coordinator, and my colleague. My name is Rachel Abuja from the News Agency of Nigeria. My first question is for the IGP. Sir, I would like to know if you if you gave your men gloves and face masks in these trying times, because they kind of stop people on the way and freely talk to them. So if you've not, please, I think you should. That it seems we're only diagnosing for now, this to the DG NCDC. And I would like to know if we're researching on this virus to review the behavioral and identity and its activities. And I would like to know if this will be localized too. This for the Minister of Humanitarian. How much is the federal government doing at these trying times to further protect the most vulnerable, especially children, from danger of malnutrition? Thank you very much.
Thank you very much. We have taken all the questions. They have been directed at the following: the Honorable Minister of Health, the Director General NCDC, the National Coordinator, the Honorable Minister of Humanitarian Affairs, Disaster Management and Social Development, Honorable Minister of Education, Honorable Minister of Interior, the Inspector General of Police, and the SGF. We shall begin with the Honorable Minister of Health. Minister of Health, sir.
Thank you very much for the questions that were raised. The first is about someone who is on Benway, as they call it, Benway case. This is a person who came from abroad and was heading to Benue, actually headed to Benue, and was feeling unwell, taken to a hospital and tested and was positive and placed in isolation in Benue. I have said before that people who are infected with coronavirus can have no symptoms, they can have mild symptoms, they can have moderate symptoms, and they can have very serious symptoms. But even without symptoms, they can be infectious. Now, this person soon recovered from the symptoms and started to doubt the test that she had undergone. And apparently there was some altercation that led the authorities there to call me. And I actually spoke with the person, and I heard that they was disputing the result because she felt very well and felt that she wasn't shown the actual result. The third complaint was that she was not comfortable where she was being kept. So we now arranged for the transfer to another more comfortable facility and requested a second test, and the test also came out positive. But in the meantime, this person feels very well, and we are planning a third test. Now, this is a classical case of what you will see with the coronavirus. We also discussed it today, in that people who feel very well and are positive think that they are not sick. Why are you detaining them, or why are you keeping them in isolation? So we try to engage this individual also through the family, because I've been in touch with the family, and I've also been in touch with, I think, told about the pastor. But the bottom line is that this person is positive but disputes the result, because she says she's well. She was shown the result and she said it's fake. So this is not anything that you can win just by that method. But by the time the next tests are done according to protocol and this person is negative, they can now, of course, leave the facility. The second one is about the primary health care. I think I can take that along with other questions regarding primary health care. Primary health care, as we know, are the basic consultation rooms. They are like clinics where people can go and report if they are not feeling well. And part of what we have said is that the primary health care will report any suspect case through the line of command to the state government and request a test. Primary healthcare centers and primary healthcare system can also play a very important role in surveillance, in going through the communities and identifying people who have symptoms but didn't even go to the clinic or didn't seek help, and advising them to seek help in rural communities or other communities where there is service of that nature in urban or semi-urban areas. So that is the role. But the primary healthcare center is definitely not a treatment center. It is not where you are supposed to treat coronavirus. In fact, if you do see a case that's suspicious, you are advised to invite that person to a holding facility and call for help. We are trying to arrange now a transport system by which anyone who is suspect can in fact be taken for testing or taken to what we call an isolation one center, where people can reside until a test is done to prove whether they are positive or negative. In the same way, the polio assets, the assets remaining from polio eradication, can serve the same purpose of surveillance and perhaps case finding and pointing the patients, or rather the cases, the persons, into the direction they should follow, which is the direction towards CDC, towards sample collection and testing. As for persons who are positive, or rather who are awaiting result, the best thing, if anybody has submitted a sample, is to try to at least use a mask or self-isolate. And if you know that you have submitted, you have classical symptoms. And as for the turnover time for testing, the DG of NCDC will respond to that. But if you do have symptoms, once you are coughing, actually, you should be wearing a mask. You should, if you are coughing or sneezing repeatedly, you should be wearing a mask. If it's a homemade mask, wash it every day with warm water, sun it or iron it, and reuse it. You should not be walking around if you have any symptoms of that nature until your results come out, and you should immediately cooperate with authorities to go into an isolation center for the sake of your family, and for the sake of your friends, and for the sake of the community. Now, the problem is that if you are told you are positive and you do not have any symptoms, please, you need to still cooperate, because without that, we are going to have a difficult time trying to protect the rest of the community from those who are transmitting, but they don't believe they are sick. And they're not really sick in the sense of being sick, but they are carriers of a pathogen that can actually cause a lot of havoc within the community. For the JACMA gifts came in, they have been distributed. Every state got a portion of it as a startup pack, so every state is properly served with it. The PTF oversaw the distribution pattern was done out. I looked at it, and the chairman of the PTF also advised on it. So every state, no state was left out in the JACMA gift and donation. Now, the turnover time, we have already answered that question, and what to do in the meantime. Now, it is true that we are all worried about the specter of community transmission. Community transmission is what is not very good news. That is why the Ministry of Health has set up an action plan that has worked the second day today to develop a strategy to address this new challenge, or rather, it's not a new challenge, but this next stage, the second phase. We are working with all our agencies, and the departments are coming up to work out what to do, what strategies to follow, and what steps to take. We were visited today by US CDC, US Center for Disease Control, came to join us today and also offer their help. We shall join that committee, and also the committee will be joined by, we'll be inviting somebody from WHO to join in that committee to have a robust action plan for the way forward now that we have entered a new phase of community transmission. I've already said the NPCDA, their role, but they are not doing any treatment in this case. The prevalence of COVID-19 in neighboring states is of great concern, and we have discussed that also. There is a plan to build isolation centers near the border, near the legal entry borders. Right now, what we have done is to accept, although the borders are closed and there's supposed to be no movement, when Nigerian citizens turn up, they are allowed in. And what we do now is to take them to a facility where they can be isolated one by one and then screened, and go through the protocol of observation for 14 days before they are released. Those who are positive are taken into isolation centers. Those who are negative are also tested at the end of their 14 days to be quite sure that they are all right. The same protocol will be used for persons who come into the country by air, because we understand there are Nigerians who are planning to return home. Those who went on casual visit abroad and have been trapped abroad and want to return will be given and are able to get a transport back. We'll also be given the same treatment of 14 days of isolation and observation throughout that period. The UN group sent us donations in total worth $2 billion, for which we are very grateful and which we appreciate. That consignment arrived Lagos, and the Nigeria Air Force is kind enough to help us bring it to Abuja. It will arrive about 6 o'clock, Nigerian time from Lagos to Abuja. And inside are the 50 ventilators we are talking about. So it is when we have seen the 50 ventilators that we begin to plan what we want to do. But our plan is to make sure that all states get something, and also that we are able to work out ways of mobilizing critical care doctors to every state to help to set up a critical care unit, that's the ICU, because having a ventilator without a critical care doctor is like having an aeroplane and you don't know how to fly. So we have to get critical care doctors to all the states. Some states have quite a lot. We have to give them incentive to agree to go to states where you do not have critical care specialists and nurses, so that they can utilize the gifts and the facilities being set up there. But in case those facilities are not ready, we are developing the plan of being able to transport patients who require ICU care from one place to the other. So if somebody requires critical care in state A and they do not have the facility or they can't do it, we can arrange to get them with an ambulance to another state where the facility exists. And in fact, also working with the Air Force and NEMA, we have been assured that we can in fact get air transport to airlift persons from one place to the other, so that Nigerians are assured that they can get service within the country, because this is not the kind of problem that you can fly abroad with. Nobody will accept you coming to their country with COVID-19. So we are on our own, and we are going to learn to survive on our own. Okay, as for transport workers, I answered yesterday that all departments and agencies actually do try to make arrangements for mass transportation of their workers to work and back. I have to speak to Port Health Services to find out if they have arrangement for their workers. But I know that with the closure of the airport, there's actually only skeletal service at that place. So it can't be a whole lot of persons who are not able to get to work, perhaps only a few. And, but I'll still find out what arrangements have been made and if the arrangements can also be improved upon.
So thank you. Just a few questions for me. There was a first question, I think, by Friday in terms of what do we do to now make the system more effective? Like you know, there's no magic bullet. We're working very hard on this. We've improved the capacity of the Connect Center, the call center. Very early on in the outbreak, there were lots of complaints about that. But now, both at the national level and at the state levels, have been expanded. The next step, so firstly, people come into the system through different pathways. Some come from the call centers, others are calls from the hospitals. Now we're establishing clinics in Lagos where people can actually drive through and get their swabs collected through special arrangements. That's how you get into the system. So once you get in, someone has to go and collect your swab after a call has been made. Those swabs are all collated in the afternoon. They have to be distributed to 3 labs. We're adding a 4th one in Lagos in the next few days. Those tests have to be run. Many of them run overnight. Next morning, they have to be sorted, distributed, resulting. So it's a very complex process. So this is what we've been improving. And we've managed to improve it a lot, but we'll keep pushing to improve this across the country. Now, outside Lagos and Abuja and the places where we have labs, we have the extra complication of transportation from the location to a lab. So there's a courier firm that does that on our behalf. In addition, you just can't collect the sample. You have to save it in a special medium, we call virus transport medium, to save its viability till it gets to the lab. We have to distribute all of these things to the states and make sure they have enough. So it's a huge logistical exercise. So that's what we're working hard to improve the efficiency on. Now, when you now get a positive sample, there has to be an ambulance, and that's where a lot of the support that has come in has been excellent from the private sector, from the federal government. Ambulances now have to be sent out to that individual. In places like Lagos, they have multiple treatment centers, so we now have to decide on which treatment center which patient has to go to, depending on his level of severity. That has to be arranged. The treatment center has to be ready to host that individual. So these are all the logistics that now have to happen. And it will only increase as we get more patients, as we improve the system, test more. This will have to do a lot more of this. And the goal of the lockdown, from what we know about the virus now, is not to stop the outbreak. It's unlikely that we can stop this outbreak. But what we are trying to achieve is, can we work efficiently within the context of a reopening economy? So our challenge from the public health point of view is to show that we can reopen slowly and maintain a public health response within a slowly calibrated reopening economy. So that's what we have to demonstrate. And we have 2 weeks to do this across the country and demonstrate to our leadership that it's possible. There was a question of the land borders. This is the responsibility of the Port Health Services, but we'll support them in that role in any way we need to. The question of turnaround times. Once the sample gets to the lab, it takes 12 hours to report on a negative case. It takes a little bit longer for a positive because we now repeat the positive just to be sure. So there are many factors, but from the time it gets to the lab, it takes 12 to 24 hours to get the results out. Now, one thing people don't realize is the labs don't report directly the reports back to the patients because it is the state public health teams that collect the samples. So we send the results back to the state public health teams to then send the results back to the patients. So sometimes there's a delay that is not caused by the lab, and that has to be fairly well understood. The work of the lab is always done within 24 hours, even with difficult samples. The final question, I think, was on research. Yes, our primary focus over the last few months has been developing the response and get it to run efficiently. But we're also part of a few research activities, some in Lagos. We're instituting one in Abuja. There are many questions that we now have to answer on behalf of our own country. So we're beginning to do that. Everybody's learning about this new virus. This morning I was part of a global call on several issues. There are papers being published every day. Those papers have to be analyzed and they're influencing the response in real time. So there's never been a disease where the research activity on it has been as quick and rapid as it is. But we need this research. At the moment, there's no single therapeutic with proven value. Even the medicine that we're using, we're trying something or not trying that. There's no medicine, no therapeutic that has gone through a clinical trial to show that it's effective. There's a lot of work now happening on vaccines. So all of this work takes time, but it's being done at a much quicker pace than it's ever been done before. So I think those answered the questions I was posed. Thank you.
Now, you answer the one with regards to people living with disability, whether you have
Okay, so the chair wants me to answer on people living with disability. I mean, to be honest, we have a very agnostic, we treat everyone the same. As far as I know, we haven't had any patient yet among people living with disabilities, but I can't know that for sure because it's only the clinicians managing these patients. In Lagos, Edo, Oyo, wherever, we have 20 states affected now, 19 plus 1. So I will not know the personal circumstances of any. But what I'll say is the key thing is that we attempt and try to treat every patient the same. Whether you're a senior citizen, a junior citizen, living with disability, black, white, from the north, from the south, our goal as clinicians and public health experts is to make sure we treat everyone the same. And of course, I know that people living with disabilities need a little bit extra care. And I trust that the clinicians will be in a good place to do this as needed. One thing I will say, in the new treatment centers that we're now beginning to set up across the country, we've taken specific measures so that people living with disabilities will have better access, wheelchair access as necessary. So in the new centers, all of this will be well taken care of. But for now, we make do with the best that we have and make sure that we do our very best for every citizen.
Thank you. I believe I had only one question because the question on turnaround times was answered by the DG NCDC. And this has to do with banks. So with the 2 weeks ago when we implemented the cessation of movement policy, we did make an exemption for banks to be allowed to engage in skeletal services. And following that, the financial authorities actually released additional guidance to the banks. We are appealing to banks to please continue to provide financial services, especially the availability of cash at ATM and skeletal services at the within the banks. What is important for us is for banks to ensure that they comply with our advice in terms of reducing mass gatherings, having hand disinfection at entrance points, monitoring of temperature, and making sure that they observe the physical distancing measures that we advise. That is really key. We will be looking at, we'll be having a meeting tomorrow of the task force, and we will be reviewing all the exemptions as well as the protocol that we released. So there might be some changes that will come through. Thank you.
Thank you very much. Before I invite the Honorable Minister of Humanitarian Affairs, Disaster Management and Social Development, let me just quickly say that the PTF has been receiving airlift support services from the Nigeria Air Force and the Ministry of Aviation, utilizing the aircraft on calibration, and particularly the cargo coming in from Lagos this afternoon is being airlifted by the Allied Air Cargo Services, just to correct the information that is out there. I now invite the Honorable Minister of Humanitarian Affairs to respond to the question.
Thank you very much, Chairman, members of the task force, gentlemen of the press. There's a question around, let me just also respond to the question around the persons living with disabilities in the humanitarian intervention aspect of it. The ministry has carried out sensitization campaigns to these locations or where these people are. And currently, the ministry is finalizing plans on how to really take these interventions to them with their own suggestions in their own way, especially in the area of food relief. So we're working on that, and we're very mindful of the fact that these people have special needs. There's a question around the palliatives given to Ogun and Lagos State. I don't know whether you are specific on the conditional cash transfer. Well, that has already taken place in Lagos and in Ogun. Last week when I visited Ogun, they were in the process of doing the registration because Ogun was not in the program, unfortunately. Lagos also is not on the program. But we have started the process of doing the registration of the capturing of these beneficiaries in Ogun State for the conditional cash transfer. But for other palliatives, we have taken to Ogun State. The trader money intervention we have done in Ogun State and Lagos State. I flagged off that last week. And on the issue of the National Assembly members giving support or intervention to their constituents, well, I think this is what they are used to doing as representatives of these people. So it won't be out of place if they are doing that right now that they need it most. And I think I've had discussions with some members of the National Assembly that they are taking this support to these constituents. On the issue of what support of palliative are we giving to those private workers? I think you mean these people in the informal sector who really earn their livelihood daily. This set of people are also our target beneficiaries, and we are taking these interventions to these communities and satellite towns where these people live. So they are going to benefit from this intervention. Some of them are already in some of our programs, really, before the COVID-19 pandemic. So on the other palliatives in terms of grains reserves and the trucks collected from customs, yes, we're all aware that Mr. President directed that we get the grains from the General Grains Reserves from Ministry of Agriculture. That is in progress. We have collected the ones that is meant for Lagos, Ogun, and FCT. We have deployed one for Ogun, Lagos. FCT is awaiting one particular grain for us to hand over to them. On the 150 trucks from customs, this is what was pledged by customs. So far, we have only 40 trucks available. We've been able to collect 20 trucks of rice from these locations, One and Lagos. We have given Lagos their own share. We have taken to Ogun. The one for FCT is on the way. And then we have also given to Imo State and Ebonyi State 2 trucks of rice for Ebonyi and 3 trucks of rice for Imo. Why we have disparity in numbers here is because we're supposed to get 19 trucks from the One depot, but unfortunately we're only able to get 5. So we gave Imo State 3 and Ebonyi 1, but we're still in talks with the Nigerian Customs to see how they can complete the remaining balance. This is where we are on that. On the issue of malnourished children, well, as you are aware, Mr. President also directed that we should continue with the homegrown school feeding program without compromising the objective of that program. We are finalizing modalities to distribute these food vouchers for food of up to 3 million households. Vouchers will explicitly state date, time, and location of pickup in line with the protective measures. And other modalities, once the modalities are finalized, the structure in the 3 frontline states highlighted by Mr. President will be prioritized, followed by the other states. We have secured the support of the World Food Program to support us with other logistics in this regard. We have adopted also a door-to-door voucher distribution system. And this is what we hope to do. And in that package, we have a complete nutrients, nutritive value in that package. We have rice, we have beans, we have soya beans and other condiments that will be provided to these households where these children come from. So that's what I can say as regards to the malnourished children for now. Thank you very much.
Honorable Minister of Education.
Good afternoon, ladies and gentlemen. I have 2 questions. The first one said some people have not been paid their salaries. Well, as far as I know, there's nobody who has not been paid his salary, his or her salary. And I know the directive of the president is, in spite of the lockdown, or perhaps particularly because of it, nobody should have his salary withheld. But since I'm just coming today, and I've been meeting the education family through Zoom at home, but I hope I'll be in the office tomorrow. I'll try to find out. If there's anybody, then I will attend to that. The second question is, children have been out of school, whether the ministry is thinking or doing anything about giving them their lessons at home. Yes? And the ministry has been planning even before COVID, only that because of it now people know about it. Some of my tertiary institutions have already been given their lessons, some online, and the ministry is working with the Nigerian Television Authority and the FRCN to start giving lectures, not just because of COVID. I hope this will become a permanent feature of our educational system. So lessons will be given online. Last time I met with the vice chancellors, with the education family, I even talked to the press and told them I have directed institutions of higher learning to start thinking of giving lessons to people where they are. So I think that's all. I'm already aware that there are some private institutions, 2 or 3 that have come to my knowledge, who are already giving lessons online. So it is already a feature. Thank you very much. Specifically, the one I said we are talking with the Nigerian Television Authority is actually basic education, primary and secondary schools. And note, we are doing this before COVID-19 pandemic came.
Honorable Minister of Interior.
Ẹ káàsán o. Ó dàbí ẹni pé èmi náà fi ṣe ògbúfọ̀ èdè Yorùbá ń bíbáyìí. Ohun tí olùbéèrè béèrè ni pé kí ni àbáyọrí àṣẹ tí ààrẹ pa lórí àwọn tí wọ́n sọ kó máa gbà ní ìjọba ìbílẹ̀ kọ̀ọ̀kan. Ohun tí máa sọ ń bẹ̀ ò ní pé ńgbà tí àṣẹ yìí dé ó bọ́ sí àkókò ìséde tí ó dí àwọn òṣìṣẹ́ ìjọba lọ́wọ́ tí ó jẹ́ kán lè ṣiṣẹ́ tó yẹ kán ṣe. Torí ìdí èyí àṣẹ ààrẹ ó ti wà ṣùgbọ́n kò lè múlẹ̀ torí ìséde ti rògbòdìyàn COVID-19. So kí àwọn ọ̀dọ́ wa kàn fi ara balẹ̀ pẹ̀lú ìrètí pé àṣẹ ààrẹ ó máa dá mímú ṣe. Olùbéèrè ó tún béèrè nípa ìrẹsì tí ààrẹ ní pé wọ́n máa fún àwọn aráàlú 150 trucks. Mínísítà fún ètò àánú àti ìdádúró jàǹbá ó ti sọ̀rọ̀ nípa ẹ̀. Ohun tí máa kàn sọ Yorùbá òun ní pé ká tiẹ̀ gbọ́ pé gbogbo 150 trucks yẹn ló wà, bags mélòó ló wà ní 150 trucks. 600 bags ní truck kan gbà. Tá bá ní pé ká wá wòye tó máa wà ní 150 trucks, ó jẹ́ 90,000 bags ló wà ní gbogbo trucks tá à ń sọ yìí. Olùdarí ètò àánú àwọn èèyàn àti ìdáwọ́ ìjàmbá dúró ti sọ fún wa pé 40 trucks ló ń rí gbà ọ́, ṣùgbọ́n ká tiẹ̀ gbọ́ yí pé 150 trucks gan ló wà tó ń dẹ̀ ti pín 90,000 bags ló wà ń bẹ̀. Káwá ní pé ìdajì náà tẹ̀fẹ́ pín fáwọn èèyàn 180,000 ló lè gbà, jẹ́ ká náà fi ojúsùn kùn wó, kò síbi tó dé o. Olùbéèrè tún béèrè nípa, ó sọ̀rọ̀ nípa wàhálà tí ìséde yìí mú bá àwọn àdúgbò kan ní ìpínlẹ̀ Ògùn àti ìpínlẹ̀ Èkó. Nígbà tí olórí àwọn ọlọ́pàá máa sọ̀rọ̀, ó lóun ti dá àwọn ẹ̀ṣọ́ síta ní ìpínlẹ̀ méjèèjì láti rí i pé ẹnikẹ́ni tó bá kọjá àyè nípa dídá àwọn aráàlú láàmú pé ó máa fi mú dọ̀rin. Ó dẹ̀ tún rọ àwọn ọlọ́pàá, àwọn agbófinró, ó rọ̀ wọ́n pé káwọn náà má kọjá àyè wọn o. Èyí tí wọ́n kàn á fi kún rèé, gbogbo ẹ̀yin àgbààgbà àdúgbò, ẹ pé àwọn ọ̀dọ́ yín tó ń ríṣẹ́ ṣe, ẹ bá wọn sọ̀rọ̀. Bá wọn sọ̀rọ̀ pákókò yìí kọ́ ló yẹ kán wá da àdàlúrú, àdàgbòrúrú. Ẹ̀yin tọ́lọ́run bá pèsè fún ládùúgbò, ilé ìjọsìn ní, ẹgbẹ́ ní, ẹ̀yin náà ẹ máa so oúnjẹ tẹ́ ẹ fi lè máa fún àwọn ọmọ yìí kàn tẹ́ máa róúnjẹ jẹ. Ẹrù tó wà ńlẹ̀ yìí ìjọba nìkan ò lè gbé. Àwọn ọmọ tẹ́ ẹ rí pé wọ́n ní àrùn ìdàlúrú yìí lára, ẹ pè wọ́n bá wọn sọ̀rọ̀. Tẹ́ bá ṣe bẹ́ẹ̀, á dín rògbòdìyàn kù, á dẹ̀ ràn yín náà lọ́wọ́, á dẹ̀ kún àwọn ọlọ́pàá, á kó wọn lọ́wọ́. Olùbéèrè ní kí ló ṣe táwọn ọlọ́pàá kì í fi ń lo ilé tí mo ń lò yìí, wọ́n máa tó bẹ̀rẹ̀ sí lò ní agbára Ọlọ́run. Ẹ ṣé.
Thank you very much. We will now take the Inspector General of Police.
Thank you. Most of the questions that were asked, I could see that they were repeated. So I will generally give answers to the repeated questions being grouped in one place. As I told you when I spoke, I said for the deployment of our personnel, we came up with standard operating procedure. And those standard operating procedure were hinged on making sure that those that are not supposed to move are not allowed to move. And those that are allowed to move for essential duties are given unfettered access in terms of movement. And while we are doing that, whether we are restricting movements or allowing movement, we do that with respect to the rights of Nigerian citizens. When a situation where some security agents go beyond their duties to take bribes, that can never be tolerated, and that is not what I've been told to do. It's against the institutional values of the police and other security agencies. Such individuals, when identified, as civic responsibility of every Nigerian, we need to report such people for actions to be taken so as to prevent such an act. We've deployed our escort personnel. These are police officers that police the police to check this kind of abuses of human rights and untoward activities like this bribe taking. Anybody caught, we deal with them squarely. Livestock and other agricultural produce are parts of the essential items that have been allowed to move freely. And if there's any delay caused by any security agent, we, as I said, if I leave here, we're going to re-emphasize and tell Nigerians, provide telephone numbers and contact persons that people can easily be contacted to report some untoward activities by security agents so that intervention can be done for easy access for those that are allowed to move. Concerning masks, our personnel are carrying masks and other protective gears, but we know they are not enough. Because they are not enough, we ask them to liaise with the various state governors, because we know each state government have their own arrangements to provide these kind of facilities, protective masks and other health protective items. We ask them to liaise with them so as to get provision from the state governments for them to be able to do their job. Thank you.
Thank you very much. We will now take the SGF. No, it's just to wrap up.
Oh, okay. Just to thank all of you for your questions. I think virtually all the questions that were asked have been answered. There was one, I didn't hear anybody say anything about it. Whether the synergy with the subnationals is not working. Let me assure you it is working. The President himself acknowledged that in paragraph 51 of his speech yesterday, where he said the response of state governors has been particularly impressive, especially in aligning their policies and actions to those of the federal government. So the President himself acknowledged the fact that we are working in sync with the state governors. Don't forget the fact that they have imposed different restrictions at different times. But I can tell you that it's all intended to flatten the curve, reduce the people congregating together, and in the process of accelerating community transmission. I have spoken to the chairman of the Governors Forum yesterday on a video conferencing. I'm going to join them at the Governors Forum video conferencing tomorrow. I will raise basic issues of urging them to align with whatever the federal government is doing, so that we all collectively work together to ensure that we deal with this particular pandemic. But the assurance I want to give is that we are working in a collaborative manner, because each subnational has got its particular characteristics, and they would have to deal with the restrictions of movement based on those characteristics. I have not heard directly from any zone about their inability to lock down. Probably when I join them in their video conferencing of the Governors Forum tomorrow, I would have a first-hand information as to what is happening in the different geopolitical zones. But I want to assure the Nigerian public that we will work collaboratively to ensure that we confront this particular pandemic. Thank you very much. I think that's the only question that was left.
Thank you. That brings us to the end of today's national briefing. Two messages are coming out of this briefing today.